going to help one a lot. So today we'll be talking about why breastfeeding is important, breastfeeding situation in Pakistan, how breastfeeding works, the anatomy and physiology, optimum breastfeeding practices, positioning, and problems associated with breastfeeding. So first of all, why breastfeeding? Generally, when I'm taking a lecture, I would want to hear it from you all, but that's since we cannot. So I would just go on, but do think about it yourself. I mean, just don't go. Let your just let just do not sit idle. Make your minds work. That why is it? Do you think it could be or it is important? So basically, the benefits of colostrum. Colostrum is basically the initial milk or initial secretion that comes out of a woman's breast is colostrum, and it contains all the nutrients that a new body born body needs, such as it needs a lot of immune system boosters and proteins and a lot of carbohydrates. So all these things are contained in this fluid, and it has enough fluid also. It immunizes the baby, and it has a mild laxative to clear the meconium and prevent jaundice. Meconium is the secretions of the intestine while in the womb. So that is something that needs to get out of the body, and that is something that is needed to be washed out. The colostrum helps it. It's very sad that initially lots of people discard this colostrum and say that this is the bad milk and this needs to be get rid of, but that's not true. It has very very important features, and it is almost 100% required for the health of the baby. Uh, so the advantages of composition of breast milk, it is low in protein, and which creates less stress on kidneys. It's easy to digest, and it is less allergenic, with a higher ratio of whey, which is it's a type of protein, casein, and it is better absorbed. Then it is high in lactose, which is the source of brain development, which is required for the brain development of the baby. It has good fat composition, which is easily digested, whereas hind milk has more fat. By hind milk we mean the cow's milk, right? Then we have high water content, that's 87%, and there's no need to give water during the first 6 months. People generally give saying that बच्चे का पेट नहीं भरा, वो he's not full. Now we need to give him water and other things, maybe some kind of a ghutti or something. But ideally, it all these things are not required at all whatsoever. So the immune factors in breast milk, I mean, there's a long list. You see, there's IgA, macrophages, lactoferrin, lysozyme, bifidus factor, and antiviral factors. All these things are being produced in the breast milk. I mean, what human-made milk would have such efficient immune, factors. It's very surprising, and it is very um, easy to have this, but unfortunately, we have still not developed the fact that everybody needs to breastfeed, and especially exclusively for the first 6 months. We'll be talking about it further. So, breastfeeding prevents and delays all the allergies. It blocks the SGIA, SIGA, blocks the entry of foreign proteins and other allergens. It avoids early exposure to proteins in animal mix that acts as allergens. So if cow's milk or goat's milk is being given, so it may have some kind of allergens for the body. But this is something that prevents allergies naturally. Um, Again, there is it reduces the chance of developing it. I have seen so many studies. If you go and Google and see breastfeeding and asthma, breastfeeding and COPD, breastfeed. So all those people who have been breastfed in the early years have been known to be saved, or at least have better coverage of the allergies, and they will have reduced allergies rather than somebody who has not been breastfed. The maternal benefits that are there. Um, it says, the Quran says, mother shall suckle their children for 2 whole years. That is for those who wish to perfect the suckling. So basically, uh, uh, 2 years is something that is allowed, okay? And that is what is recommended. And it, I would I would not say it's an order kind of a thing, but it's best for your self as a mother, and for the child. It enhances the mother's rights threefold. In Quran only it has been mentioned that on the woman who is breastfeeding is supposed to be, sort of being paid for her services, because she is going through some job, and that's recommended, and it even elevates the women who are wet nurses. So we all know that Prophet Muhammad sallallahu alaihi wasallam was breastfed by Bibi Halima. So she has a good space in religion. So it's very important, and the if somebody is practicing Muslim, it's very important for him that it
मैडम
is. जी
हेलो
शायद भाई, जी शायद भाई।
मैडम आपका इंटरनेट बहुत स्लो चल रहा है इसकी वजह से आवाज में बहुत घुमक है वाइब्रेशन है या
अच्छा
तो आप
मैं
हेडफोन चेंज कर
अच्छा मैं 1 मिनट इसको चेंज करती हूँ।
जी
1 मिनट दीजिएगा। ना, लड़ा नहीं। ठीक है। अच्छा, अब now if we talk about maternal maternal
नहीं
benefits,
मैडम
it
आवाज फिर खराब हो गई मेरे ख्याल से आप थोड़ा सा वो चेंज तो करें रूम वगैरह जहाँ पे मुझे लग रहा है
अभी
इंटरनेट का मसला है
अभी नहीं आ रही।
अभी देखिए कभी सही हो जा रही कभी खराब हो जा रही
अच्छा मैं फिर एक और इंटरनेट पे स्विच करके देखती हूँ। Okay, so maternal benefits of breastfeeding. It's in this it helps us in the mother in the expulsion of the placenta. It prevents postpartum hemorrhage. It promotes uterine involution. It causes lactational amenorrhea. Okay, this is something, generally mothers or females or doctors question, that it does not cause amenorrhea, and it does not prevent conception, which has been claimed. The thing is that maybe, the mothers, the diet is different. Otherwise, science proves that it does affect. Um, it does cause reduce iron loss and prevents conception for 4 to 6 months. Of course, when a mother is feeding the child, it is the workload is very much reduced, as breast milk is available anytime, anywhere. It is clean, sterilized, and warm, so you do not have to go looking for bottles and milk, and sterilizing the bottle and nipple and all that. So it is a great help. It definitely reduces the workload this way. It does require a lot of time from the mother, because, of course, the mother has to be with the child. But then that's again counted as a benefit, because it gives you time to bond and attachment between the baby and the mother. And that this is the time that is required of by the required of by the child as well as the mother. The mother needs that kind of rest, which is being some mothers complain that the milk is not coming and all that. But then that is because probably the right kind of meal is not being taken, the right way is the of suckling is not being done. There's not enough or proper positioning of the baby, right? And of course, it helps in the pre-pregnancy weight return and figure. So it helps. It reduces the risk of breast cancer. It gives a lot of satisfaction and confidence to the mother. So these are important factors towards the maternal benefit. Then we have benefits for the baby. Of course, it is a complete food, easily digested, enough water, bonding, available for 24 hours at the right temperature. You do not have to worry, oh, you have to microwave, oh, you have अब गरम ज़्यादा हो गया अब इसको ठंडा कर दो, and all that. It is of course hygienic, and all the benefits, other benefits that we've already discussed. It gives benefits to the family. It is less expensive, almost free. I mean, if you have the right kind of uh, you know meal for the mother, it is a win-win situation. The mother is being fed and the child is being fed at the same time. There are less illnesses, so less expenditure. As we've said, that there is it reduces the time. It increases the time period of conception, so birth spacing is done. There's less work for the family to feed the baby. Breastfeeding is convenient and available. Unfortunately, the mothers who and especially if I would say low middle income country or mothers, what they do is, or what they assume as, that as we have to go for work, we'd you know sort of give the formula milk. Okay, now the formula milk, box of formula milk costs around 1,000 more, 1,000 plus, right? So what you need to do is, does the mother does not realize is that if it is said that 1 ounce of water needs 2 spoonfuls of milk, the powder milk. So now what the mother does is, just adds one spoon of powder. Now, what happens is it sort of affects the mother's, the baby's health, because he's being fed half of what he should be So of course malnutrition is going to develop. So what you need to do is give the right amount of milk. What they are doing is कि अगर एक box जो है box of milk is going to last for a week or for 2 days or for 5 days, so what they do is give the half amount कि बच्चा ही तो है इसको इतना अभी तो नहीं और पानी तो चला गया and all that kind of a thing. बट उसमें क्या हो रहा है, तो न्यूट्रिएंट्स तो नहीं जा रहे ना बॉडी में. अब न्यूट्रिएंट्स नहीं जा रहे हैं तो उसकी डेवलपमेंट उस तरह से कैसे होगी इफ ही इज नॉट बीइंग गिवन द राइट काइंड ऑफ proteins and fats and carbohydrates. So if it is not being given in enough quantity, it is going to affect the child or baby. So and if the mother or the family gives the right amount of milk, it still is not as good as the breast milk, one thing, and then it is going to cost a lot of money. So it is very important that how it should be done. Of course, it is the beneficial for the country also. It saves foreign exchange. We are not making the big dood ourselves. What we're doing is we are importing it from the like Morinaga and I'm sorry for mentioning names, but there are different and I don't know GF or BF or some and kind of different infant formulas which are coming from the different other countries. So it you are spending a lot of revenue. Then of course healthy babies, so healthy nation, less illness, child survival is better, population control is better. So all these things at the end of the day benefits your country also. So it's important. um, Now the situation in Pakistan, if you can see, this is from the PDHS, that is the Pakistan Demographic Health Survey, done in different years. And it was done in 1990. So all the orange bars depict the 1990, the 2006 is blue, 2012 to 13 is red, and 17 to 18 is purple. Okay, now you can see the different age groups that are being studied: neonatal mortality, infant mortality, and under 5 mortality. Now we could see that in 1990, if we're talking about neonatal mortality, that's not very much affected by the breastfeeding, I would say. No, but we cannot comment right away that it was not breastfeeding. But we're trying to say that neonatal deaths were less in 1990, it increased in 2006, then 2012, and then there was a major dip in the 2017 and 18. So there could be multiple reasons, but initial neonatal deaths generally are because of low birth weight or some congenital or developmental issues, maybe the heart or the lungs or something like that. So this I would not say that is wholly solely because of the breastfeeding. But then the infant mortality and under 5 mortality is definitely related with the breastfeeding. So as you can see, the decline in 1990 was 86, and in 2017-18 it's 62. So it's very important. So these trends are seen for. Then if we see this other slide, it says that infants who are not breastfed are 15 times more likely to die from pneumonia and 11 times more likely to die of diarrhea than those who are breastfed. So it's that's a big number, 15 times. So that means I mean, if we have our child breastfed, he is 15 times less vulnerable to having pneumonia, and less 11 times less vulnerable to having diarrhea. So that is a big number. um, so 69% of diarrhea patients need care seeking for diarrhea, acute respiratory infection 75%, malaria, fever. So all these things are, I mean, you think, oh, why malaria has effect because of breastfeeding, because the right kind of immune immunology is being catered for. And if a child's immunity is better, it is going to fight back better against whatever the plasmodium, the virus, or the bacteria. So it's very important. uh, Okay. So simple, proven solutions regarding all these mortality levels are exclusive breastfeeding for her baby's first 6 months, vaccinations, safe drinking water and good sanitation, frequent hand washing with soap, good nutrition, especially for kids aged 6 months to 2 years, and adequate indoor, if possible, outdoor ventilation. So all these, there's no rocket science to it, other than that, it's very, if you're going to get a vaccination done or safe drinking water. These are two things that you really have to strive for. Otherwise, breastfeeding is not no rocket science. Washing hands whenever you go to the toilet, or you start cooking, or you've had a game outside and all that. So it's very important, and it's for the mothers also. And these are the proven solutions to reduce maternal child mortality. Okay, this is now the solutions we've already talked about. This is another I wouldn't say organization. This is a um, uh, uh, system that has been provided by WHO, and it says infant and young child feeding practices. And these practices mainly talk about breastfeeding and complementary feeding. Now, breastfeeding is important in the sense that it should be. There are two factors to it: early initiation of the breastfeeding and exclusive breastfeeding. Now, early initiation that we've talked about is colostrum, giving them the child the colostrum, and then it is important that the child should be exclusively breastfed without any other food materials being introduced into his life, at least before 6 months. Giving proteins at the age of 4. There was a very common practice that old school of thought used to do. I'm not negating the fact that it may be good or it may be bad, but then science is improving. Science is proving a lot of new things. When now they're proving new things, it needs to be revised. We can't say that our nani dadis used to do that, so we have to do that. The good tea or the pani and all that, but that's not recommended. That's not needed. So why give it? Why? So we need to change this mindset. So this is why they have this program saying infant and young child feeding practices. So we need to talk about breastfeeding, and we need to talk about complementary feeding after 6 months. And breastfeeding has two factors: early initiation of breastfeeding and exclusive breastfeeding. So now you can see that there's a rise in early initiation of breastfeeding. But then there was, if we talk about 2001, 50% of the population was breastfeeding. But then in 2011 it decreased, and then 2015 it rose a little, very little, in the sense that initially we had reached the level of 50%. Now we are on 2018, it says to 45 5.4%. So again, we need to introduce, or we need to work on these practices. We need to have the right kind of awareness sessions for mothers, may it be rural or urban. Okay, there's another comparison between the different provinces of early initiation of breastfeeding. So it was seen that Balochistan is doing this practice the most. That is 61.1%. And then there was another comparison done between, like, the different socioeconomic statuses. So you might assume that, the lower would be breastfeeding more, and elite will be breastfeeding less, because they can afford the formula milk. But that's not true. It's not because of the economic status, or it's not because of what kind of money they have. It is because of the mindset, because of the understanding, because of the awareness that they do not have. So you see, a poorest is also having this early initiation as 46.1%, whereas the richest is also having 45.8%. So there's not much difference. So in between, so the range is from 44 to 46. Okay, so there's not much difference. So this is just a mindset which we need to change. If we look at overall Pakistan picture, so the best breastfeeding is in the region of KPK, that is 60.8, whereas the worst, I would say, is somewhere in AJK, that's 42.1%, right? But then we have quite a lot of rural and urban community in Pakistan, in Sindh, and because they have quite a lot of metropolitan cities. But then still, we do not have that kind of percentage of breastfeeding. So a lot of work is required to be done, right? Those are the key counselor message. That is very, these are very important that we are telling you, because inshallah, in a year's time, you all will be physicians, and you will be all giving and counseling wherever you're placed. It's not necessarily that you're placed in a hi-fi system or hi-fi hospitals. You may be catering for a lot of people who are underprivileged, who do not have the awareness, who are not so educated, who are not so well informed. So in that case, you should know the key messages that you need to transfer to them. So what you need to do is, breastfeeding has many benefits. It saves lives and prevents illnesses. And now it is how you communicate it to them. You need to tell them that it's convenient and it's less expensive. And then you need to make them understand this is something, this point number 3 is very important, because this is something that is a 100% mindset in our communities, that a child needs something else in the initial for 6 months, and if not initial 6 months, at least in the fourth month they should start being given some extra food. Whereas everybody, WHO and UNICEF and everybody says that initial 6 months is what is required exclusive breastfeeding. You can make her understand, the woman, the mother, the child spacing is going to help you in child spacing. It is going to prevent you from extra bleeding or any kind of breast cancer. And then you need to, I mean, if you're telling them what are the benefits of this, we need to, on the other hand, tell them that what the other formula milks could do. if you're not using the right kind of boiled water, if the proper sterilization has not been done, if the water has not been, the bottle has not been washed, if your hands have not been washed, it may cause severe kind of diarrhea, and which at the end of the day end up in malnutrition. Then uh, Okay. Then we have like, it, of course, it's going to cost more, and it is uh, if you feed less, the breast milk is going to reduce. That is a fact. We're just going to talk about the physiology and anatomy in a minute, and then more clearer. Then it can cause allergies. So we've talked about. There's nothing that I'm talking that is very far fetched. But why I'm emphasizing that these are the points that you need to focus on. You need to talk to them about it. You need to convince them, and believe me, you not convince them just by dande ka zor. You need to make them understand. These poor ladies, when they come from rural areas, they have all the apprehensions. They do not know how it is going to affect them. So it is important that we need to convey this to them. Now, this is the anatomy of the breast, and there are different muscle cells and different, you see, milk secreting cells, okay, which are important. And then we have the supporting tissue. Um, when the uh, okay, so what two hormones are required are oxytocin and prolactin. Once the baby suckles, the nerve endings which send messages to the brain to produce oxytocin as well as prolactin. The prolactin is going to secrete the milk cells, whereas oxytocin is going to make the muscle cells contract. Muscle cells which are around the sort of sacs of milk, right? So when these contract, the milk is excreted. Now, it is very important that this area is suckled the right way, so which would send signals to the brain to produce oxytocin and prolactin. So there's this cycle which occurs. It says that there's pituitary releases prolactin and oxytocin. How is that being produced? Okay, so we will just go in the cycle. When the hormones travel via bloodstream to mammary gland to stimulate milk production and milk ejection. So reflex will let it out. Infant suckles at the breast, and okay, there's this is the mechanism that works. It's like this: the baby is suckling, the message is being sent to the brain, that is pituitary gland, and then it is the prolactin is being produced in the blood. Same as this oxytocin being produced and delivered in the blood. Now, once this happens, it makes a cycle. It makes a feedback mechanism that the minute the baby is going to suckle, and at the end of the day, when even the child is hungry, all of a sudden, seeing that the child is about to cry, or the time has been set in your mind, so it starts producing milk. It's a very surprising phenomena, but it's a very easy thing, that this is how it happens. We need to understand when mothers complain, there may be some reasons which we'll talk about in the last slides, but generally, if the proper suckling is being done, proper milk will be produced. This is how the storage of breast milk is to be done in the sense that it should be done at 40-degree Fahrenheit. It should be placed in ice packs for 24 hours. It should be stored at room temperature for it can be stored at room temperature for 6 to 8 hours. No hind milk or no goat milk or cow's milk can survive 6 to 8 hours in the room temperature. It is going to go bad. So just look at the capacity of this breast milk, that it is not going to go bad. You can also freeze it and use it for 2 weeks, and it won't go bad. And then you can even use it in deep freezer for 3 to 12 months. So that's a long, long time. Yeah. And why and how of a breastfeeding can be done effectively is that it's very important, and especially initial 6 months, that 8 to 12 times daily, frequent feedings should be done. There should be intermittent episodes of rhythmic sucking with audible swallows. Integration, indi- indication that the child is being fed well is that he would use 6 to 8 diapers in 24 hours. So it would give us an idea, or the mother the idea, that he is feeding well. So it's very important. And average daily gain of the child is should be 15 to 30 grams, and this is the initial 6 months. Yeah. The infant has or should regain birth weight by day 10, because initially he does lose a little weight. Okay. So good feeding techniques is that it should have effective latching. It should the proper exposure of the breast should be done so that the child can hold on it, and so many things. I will give you the positions in a while. Then optimum breastfeeding practices is that it should be early initiation, no pre-lacteal feeds. That is, we need to give colostrum and not the gutti that we talk about, or the pani that we give, or all that. Yeah. It should be ideally 6 months of exclusive breastfeeding, but in some places, if it's very important, the mother has to go to work, it cannot be handled. So 4 months, not less than that. It should be A child should be fed on demand. It should be 8 to 10 times per day. Whenever he's crying, you need to feed him. You need to use both the breasts, and then you need to continue breastfeeding for 2 years, which is important for your health also. Um, we've talked about what exclusive breastfeeding means. So no semi-solid foods, and no water, no tea, sherbet, and all that, right? What is demand feeding? When the if baby is fed whenever he cries, or the mother feels a need to feed. Okay, the mothers generally complain, oh my God, it seems that we have been feeding all day long. But that's what you're supposed to do, ideally. But of course, you have your daily chores also, you need to face them, you need to fix them. So for that also, you need to have it organized in such a way that whenever the child wants you, you need to feed him. Or if you think that you're busy, get it pumped and use it like that. Within 2 weeks, they settle into routine. So it's important you also get to know the idea what timings you would be feeding him. Okay. And when people say that we have it scheduled and we will feed every 2 hours or every 4 hours, that's generally is not a good idea, because you need to feed whenever the child wants to take the milk, because otherwise he's not going to latch well, he's not going to position well, he's not going to suckle well. And if he doesn't do that, the milk production is going to be reduced. Positioning of the baby, the basic point is that it should have the rooting reflex should be there. The mouth should be wide open, and it should latch on well, like this, right? And there are different positions, the important things when we are. This is a good position, and whenever we are using a sucking, the child gets used to easy access of milk, because the bottle allows sucking easier, rather than sucking and suckling of a breast milk, because for that he has to use his muscles to pull, to make the oxytocin and prolactin produce, so that the milk is being produced. So it's again, it is very important for your jawline and for your mouth that your child suckles. Otherwise, it is not going to be that good. We have different positions. This is a cradle position, modified cradle position, but you need to support the child's head with your arms, or if he's not coming up to the level, you need to place a pillow under him. um, this is the football hold position, the supine position. The basis is that the child should have a wide mouth open, and he should be able to latch. The problems associated with breastfeeding is engorgement, simple sore, sore of the nipple, mastitis, insufficient milk, sick mother, working mother, mother on drugs. Now, if the child, if there's engorgement and sore nipples or mastitis, I would say the positioning is not right, and so is with the insufficient milk. The positioning is not. We need to first address that. Then we have, I mean, unfortunately, if there's a sick mother, she is immunocompromised herself, she has tuberculosis, or she has some kind of an HIV or something like that, then of course it is important that whether the physician's decision that whether they should be, you know, uh, uh, breastfed or not. If there's a working mother, of course she can pump her mother, the milk, and maybe give the child later. And mother on drugs is again depends how much she is taking, whatever the drug, and if it's very much prevalent in her blood, then it is not a good idea. Um, so sick mothers are supposed to be encouraged feeding in case of cold, flu, or fever, and or feeding or expression during illness will sustain milk supply. But if the mother has tuberculosis, then and if the sputum is negative, continue feeding. But if the sputum is positive, then give INH to the baby for 6 months and continue feeding. Um, okay, infant-related problems. There could be thrush, crying baby, nose block, lazy baby, early onset of jaundice, nipple confusion, and neurologically affected baby. All these things are not something that can be overlooked. But then in thrush, it is because of the not a proper positioning. Otherwise, if the baby's nose is blocked, you need to address that. If the baby is lazy, you need to wake him up. Sometimes really it happens that while feeding, the baby sleeps, and then you need to wake him up. But then that is something, some task for the mother, but she needs to be doing it. That's all for now. शाहिद भाई, अगर आप एक 2 मिनट के लिए बस चैट खोल दें, students if they want something to ask.
मैडम
जी
चैट
चैट
करूँ?
खोल, जी जी चैट खोल दीजिएगा. If there's
चैट
anything that you want guys to ask, and this is my email address, the class CR. If that's okay, then please kindly email me, class CR. Then we can, I can send you the email. Why am I closing the chat, Ariba? Because these are the orders from the admin. Now, there has been some issues regarding the students sending some inappropriate messages. That is why we are ordered to close it. If there's any query regarding the lecture, please kindly type right away, because we just have hardly a minute. In case of mastitis and breast abscess, what can the alternative to breastfeed during treatment of the if even if you're on antibiotics, you can still breastfeed, Minha. But of course, it is going to be a little painful for the mother. So in that case, see, I am not saying that if there's some issue, you are not supposed to use formula milk, but that should not be habitual. If, for example, you're having a 7-day course of antibiotic, and in initial 3 days, the pain gets better. So once the pain gets better, you can feed again, right? So that way you should start feeding, or at least expressing the milk and feeding the child, right? Okay, so seems no other further questions. So let's call it a day. Whoever the CR is, kindly email me. Otherwise, it is going to be uploaded on the LMS also. So that's not a problem. Okay, guys, take care. Assalamu alaikum, Shahid bhai.